This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
I went to medical school to help other people. I didn't go to medical school to fill out paperwork, to deal with insurance companies that don't understand the importance of my relationship with my patients. And I went to medical school so I could sit on patients' front porches, get to know them, and care for them the way that I was meant to. I am Dr. Stephanie Phillips of Front Porch Family Medicine, and this is my DPC story.
Dr. Stephanie Phillips, DO, was born and raised in Bluefield, West Virginia. She attended Emmanuel College in Franklin Springs, Georgia, where she played intercollegiate women's basketball and earned a Bachelor of Science in biology, graduating Magna Cum Laude in 2006. She obtained her medical degree at the VIA College of Osteopathic Medicine on the campus of Virginia Tech in Blacksburg, Virginia, where she was president of the Christian Medical and Dental Association and a participant in the International Missions Training Program, graduating in 2010 with her Doctorate of Osteopathic Medicine. Dr. Phillips attended family medicine residency in Anderson, South Carolina at ANMed Health, where she completed a global health track and graduated with honors. Dr. Phillips has been serving our nation's heroes at the Department of Veterans Affairs since 2015 in outpatient primary care. She has been medical director for 2 community-based outpatient clinics in Princeton, West Virginia, and Athens, Georgia. She has extensive experience caring for children and adolescents as well as college-age adults. Dr. Phillips has certification in international medicine and has led and participated in many international mission trips and has also served at the Baptist Hospital in Ghana, Africa. She and her family relocated to Georgia to take over operations of the family farm in Royston, Georgia in 2020. She is a member of Royston First United Methodist Church, and she loves spending time with her husband, 3 children, her grandchild, and her many farm animals. In her spare time, she enjoys quilting, knitting, and front porch sitting. Welcome to the podcast, Dr. Phillips.
Thank you.
It is such a treat to be talking with another rural family physician. So I'm super excited. If you have not gone to Dr. Phillips' website, Front Porch Family Medicine is her practice, and she talks all over the place about bringing the sweet tea. So she's bringing the sweet tea to the podcast today, and we are super excited to hear all of the amazing things you're doing in your community. So you did a soft and then a harder opening all earlier this year. So January, you had a milestone, and July, you had a milestone. Tell us about that.
Yeah, so in January, I was working full-time for the VA in primary care. And I opened just seeing patients on Saturdays. And that was in January. And from January to June, I grew to about 80 patients. And so that was huge. But then we opened full-time in July. I opted out, and I've grown just from July to now already to 150 patients. So really exciting and really fast growth. And that's kind of how my journey went so far.
I love it. And let's go into your environment where you're physically practicing, because we mentioned that you are rural, just like myself. But how rural are you and where are you in the state of Georgia?
So I'm in Northeast Georgia in Franklin County, Royston, Georgia. So Royston is a town of about 2,700 people, very small. There are several other towns around me. So I'm in a kind of a tri-county area. So I have 3 other counties, 3 other cities that are close by. Each of those places have 3,000 people. There's also another DPC only 15 minutes down the road from me. She has been super successful and kind of mentored me and helped me. And she filled up in like 7-8 months. So I decided to open with some encouragement from her for sure, because I was scared about it being a rural area. But it's been shocking how many people still are calling and coming, even with this just small area. It's actually a farming community, mostly agricultural. Franklin County has more chickens raised in this county than any other county in the whole entire United States. So a lot of chicken farmers, and it's just been awesome.
So tell us about that fear, that hesitancy when you were saying, like, I don't know if this could work rural, because there are other people out there who have that same fear. And just today I was reading a post online about how there's even specialists who are rural, working rural, but their hospitals are changing the policies, eliminating physicians, and specialists are wondering even like, how could I do this? Because I'm rural as well.
Right. The patients are there. Like, so even if you're rural, there's still a huge need. And patients, no matter if they're in a city or in a country, everyone has trouble finding doctors, especially specialists and family doctors, everybody. And I think it's everyone's disenchanted with the way medicine is. Everyone's tired of it. And so that's why this really works. It takes people getting in the door a lot of times, but once they get in the door and they realize, hey, this is real and this is happening and this is affordable. Same with the doctor. So when I first opened in January, I was like, I'm not 100% sure I'm even going to do this, because I don't know if it's going to work. I'm scared. I have to have my salary. I have to pay my bills. My husband's a farmer. So I'm pretty much our main sole earner. He makes some, but nothing what I made. So it was important to me to be able to have that financial security. So it was really scary. And I was like, I don't know if this is going to work, but it works. And it really is the right thing to do for patients and for my mental health. It's been awesome. Some of that scaredness went away once I started seeing all the people call and all the people who just were so thankful for the service. And interestingly, so you think, oh, okay, well, you're only going to get like uninsured, underinsured, working class people, but there's a lot of patients. It's such a mix of patients that I have. So I have working poor who are members who absolutely need the service really badly. And then I also have, patients who are very well off who just want to have that access to a doctor on the weekend. So it's such a big mix of type of patient, because I really thought it would just be higher income people that would be signing up. But actually, the value that we provide to patients who don't have insurance is astronomical. So they're shocked to see how much they can get for just a small fee every month. And it's really interesting to see how they look at me when I say, oh, no, that's included. They're like, what? That's included? Okay. There's a huge amount of value that they get from the membership.
And just from what you're saying, you're implying, or what I'm hearing is that you're implying that healthcare access is definitely an issue there when it comes to quality access. So what is the landscape in your area in terms of like the big fee-for-service clinics, satellite fee-for-service clinics? What options do people typically have in your area without DPC?
So the options that they have are doctors' offices that are hospital-owned, that are full of doctors who are burnt out, family doctors who have too many patients. There's actually one county right next to me that has only really one clinic in the entire county for an outpatient care. At that clinic, there's a line of people to get in every morning of 20 to 30 people. So if you want to be seen there, you have to go in there. There's no urgent care services in that county. And it's just a nightmare to try to get care. And this is a rural county. So I've gotten a lot of people from that county. That's about 20 minutes away. I have a lot of patients from that city too. And these hospital-owned practices, they know the doctors are overworked. They know they're going to get a 15-minute visit. And a lot of patients who come to me have actually said, I told my doctor about this, but I know they just had time to order a bunch of tests, and I really want to get down to what's going on. And I always try to, anytime a patient comes in and tells me something like that their other doctor didn't pay attention to them or whatever, actually even try to point out, it's not because that doctor is a bad doctor. Because honestly, I used to have to do that too. Because if I'm already an hour behind and I've got 3 other people waiting on me and you've got this very complicated problem, a lot of times I'm just going to basically order every test I can think of because I don't have time to sit down and take the time that it needs to actually figure it out. So it's not because they're a bad doctor. It really isn't. It's most of the time they would like to have time to sit down and talk to you. It's just that our system is set up the entirely wrong way. And they're probably good doctors out there. And I try, I want to get those doctors into my way of doing things because I think they'd be a lot happier. And patients would be happier too. But it's just the kind of system that they have access to is totally different. And they're not able to get same-day appointments. Most, especially pediatric offices around here, are not available. They don't have same day or even same week. So a lot of times kids are waiting 2 weeks to be seen by a pediatrician. So they're utilizing an urgent care with mid-levels who do not know them at all, which in my opinion is almost kind of dangerous. It's just bad. It's just not quality care, in my opinion. So to have a doctor that you can call at any time for your kids is priceless. So especially in a rural area, because you're driving even just 2 hours to get to a pediatric ER.
Amen. I am in a totally different locale, but I am totally with you in terms of, to get to the nearest inpatient pediatric unit is an hour and a half away for us. NICU, hour and a half away, it is unreal how access in rural America really works for healthcare. So I am so grateful, as well as all of your patients. And I know you are, even for your own practice now, that you are open. So bring us back to that time though in January when you doing clinic on Saturdays and you were still working at the VA and you were like, I don't know still, but I'm at least willing enough to try. What was it that made you even go to doing Saturday clinics versus I'll just wait a little bit longer?
Yeah. So I had heard about DPC years ago when I got out of residency. And I came up with Front Porch Family Medicine, the name of the clinic then in 2013. And I even designed a logo and everything and wanted to do it. And I got scared and I backed out because I had a bunch of student debt. And so for me, the big draw was getting out of my student debt. So I had worked for the VA for 9 years in federal service for that long. And so I actually got my loans forgiveness. So that for me, not having that student loan payment for me was a huge deal because I had already kind of designed my life around the salary that I needed. And I had car payment, a farm payment. We bought a $500,000 farm, so I had to make that mortgage payment and there was no getting out of that. And so we decided to just let me work in this horrible system that I'm in. And I actually was really not miserable the entire time I was at the VA. I was at several different VAs. There were times I was happier with my job, but overall I was overworked and it just kept getting worse and worse. And I felt like they kept adding and adding and adding more things. And I was so disenchanted. And so when I got that letter from the public service loan forgiveness, that was really what put me over the edge of just you know what? I don't have this burden anymore. I'm going to move forward and just jump right in. And that honestly for me gave me a lot of security to know I wouldn't have to make that payment anymore, that I just got to be able to just, be done with it and say, okay, I'm doing my own thing. And also just hearing my patients when they came in for me, they would see how downtrodden I was. And they're like, I can tell this is killing you. And I know you're so busy and you have so much. And they would actually come in and see a pile, a 3-inch pile of paper on my desk. And they knew, and just hearing them say that, and I'm just like, you know what? Even my patients know that this is killing me. And that was a big one too. And my little daughter saying, Mommy, I never see you. She's about to turn 7 this week, actually. And she would come home and be like, Mommy, I don't ever see you. Because whenever I'm at home, I'm on my laptop trying to get stuff done when I'm not at the office. So I was working, 60-hour weeks. And it was just, and I just got this point where I was like, you know what? This life is too short. Life is too short to just spend all day on my computer all the time. It's just too much. I don't want to miss it. I don't want to miss my baby's life, you know? That was another big thing.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
It's so awesome that you made this change when your daughter's still little. And I love that, she's only going to be about 7, but I'm guessing that already you've had so much difference in your life that, like, in terms of spending time with her. So what have you been able to do now because you have a DPC practice?
Yeah. So my practice now is like really close. I was driving 30 minutes to work. Now it's like 5 minutes from my house. So now I get to pick her up from school. I work 4 days a week now. So I have a whole day. In the summer, I'll have a whole day off with her, but now she's in school. So I get to spend more time with her. I pick her up from school on my day off and we spend more time together. It's just been overall great. I can leave the office and not work. Sometimes I do have to. I mean, I'm still busy. I still have a lot of stuff that I do. But at the same time, like, it's not every single night I'm on my computer. It's not every single weekend I'm just on my computer. And like, I actually have weekends off now. I don't work it on the weekends, which is totally different. And just, I've noticed a difference in her. And like, she's a lot more attached to me the last few months, I've noticed too, because I think she knows I have more time. And so she wants mommy. And that's so cool to me because I'm like, she never really cared about me before. Like, she did, but you know what I mean? Like, my mom keeps her. And so she actually asks for me now. And it's just like, I get to be mom. And it's just so fun and such a relief to know that I'm not having to. And I would even find myself buying her gifts and trying to get more like material stuff for her because I felt guilty. And I don't have that tendency anymore. Like, I just want to spend time with her. It's just really cool. I just don't even care about the money lost right now. It's just about her. So
yeah, that time in that relationship is so well deserved. So I'm super We're glad for you both. Now, going back to when you mentioned your patients were even telling you like, this is going to kill you. I know that there's people out there who are thinking about their own patients in fee-for-service who have said that to other doctors who are listening right now. And I know, I definitely know that, especially at the end of my stint in fee-for-service, it was like, if I do one more day, like, I will not be able to continue medicine as a career. And my patients, especially the people who followed me over for my practice, like 80% of my patients who joined my DPC were from my old practice. And they made comments like that. Like, you were so stressed in fee-for-service, or like, you are so much happier now. And it's amazing how, even though we try, like you're saying, it's not that the doctor is bad. It's just the system that they're in is really impacting how they are able to do quality medicine. Like, I remember conversing with my husband about like, but you sent that person to a cardiologist, but you could have done that yourself. Or like, why did that person go to derm? Like, you are a physician and surgeon. So like, why? Because he didn't have time. And so
yeah,
that is a thing that I really feel residents also are picking up on now. And even medical students, when they're shadowing, they're like, what do you mean? Like, I remember, I think it was Dr. Cindy Rubin. She said that a medical student asked her, like, why do you have 15 minutes for everyone? And she's like, because that's just how it is. And like, so it's amazing that you also experience that. It's sad that, there are so many of us who experience those moments when that's not at all what we signed up to be doctors to experience. So I love that you're, again, doing your DPC practice. And I think that's so cool that you had this time, I get it that you were working towards paying off your loans, being in a different place to then jump. But I love that you were working on your logo, which I love. It has a super cute stethoscope hanging off the front porch chair. It's awesome. But let me ask you, if you were to talk to yourself after finishing residency with all of these loans and whatnot on your plate, would you have told your previous self anything different in terms of, I know that you've heard about DPC. I know that you're scared, but your future self is telling you XYZ.
Yeah, I wish I had just done it then. I just feel like I would have been so successful even then, right out of residency. I feel like I wasted 10 professional years of my life. You can make that payment. I could have easily made that payment just for the rest of my life. Who cares about the 10 years and the forgiveness? I could have just paid it off. I mean, at the end of the day, it's not worth it to grind in this mess and just get burnt out the way that I did. I mean, it's not how we should be taking care of patients. And I knew then it was broken. I knew then I would be burnt out, and I just did it anyway. I just ran the rat race, and I just wish I hadn't. If I could go back 10 years, I definitely would tell my 10-year self, just go, just do it. Because people need doctors. They want a doctor. We have a service. This is basic business 101. We have a service that people need, and people will pay cash for it. They will pay cash for what is quality medical care. They come in, they see what they have. If you do this right, if you follow this model the correct way, it will work. I think it's 100% fail proof. It's just, I don't see how it could fail, really. I really don't. I think there's a lot of research being done, and there's a lot of talk about why do DPCs fail. I've been seeing them on the Facebook groups that we have with the doctors and everything. And it's really interesting. And you look at the reasons that they fail. Most of the practices that are failing are not following a model. They're either too expensive. My fee is $75 for everyone a month, period. And in a rural area, I see a lot of other practices charging a lot more. I don't plan on increasing my fees. I don't think I need to, because I can see the patients I need to see and not be super busy and have plenty of openings for people and not charge more. So I just don't see, I know there's a big trend, increase your prices, do all this thing. And I just don't see where that is going to help my practice grow or help me get any more value. I just think that 75 is a great price point. Yeah, maybe more, who knows, but I may stick my foot in my mouth in 2 years and increase my prices. I don't know. We can. But at the same time, people are going to pay more. They are. But I think the higher prices are going to cut off certain people. And I know you didn't really even ask this question about why DPCs close, but I think it's important to talk about, because I want to know the reasons that they're closing myself. Because when you're opening a business, you want to know, okay, what are the reasons people are failing in this business that I'm opening? So I think we need to be talking about these things. But for me, making it valuable in a rural area, I needed to have a good value price point for uninsured patients, because that is a lot of my group. I would say probably 25% of my patients are uninsured completely. They don't even have a health share plan. And I'm trying to get them to get one, because I want all my patients to have some kind of insurance or, for catastrophic things. So yeah, that's where I'm at with that, with the business plan and everything. But I just want to encourage others to say, okay, yeah, we have a product that people need. And this is just a great thing that we're able to do. And we can do it. It doesn't take a rocket science. It's so easy to do, so.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
I love that you mentioned thinking about why do DPCs close. Soon after your interview airs, we're going to have a physician whose practice closed. And I definitely encourage those who are out there. Like, I know that there's this whole, that most of the episodes on my DPC story are about successful direct primary care practices in all different sorts of locales. However, I absolutely encourage those people who are, who've chosen life after DPC. Like, they're still alive, they're still breathing, they're still doing whatever they want to. I go back to Dr. Whitney Webster Pack's episode where she says, even if your DPC closes, you did it out of love. Like, you did it because that's what you needed to do. And so I definitely encourage that if there's a physician out there who has chosen or is soon going to choose to close their practice because there's something else that they want to do, like they want to travel the world or they want to go back into fee for service, they want to do whatever it is. It's like, amen. But definitely I encourage you to go onto the contact page of mydpcstory.com and sign up to do an interview also, because I think that is such an important topic, because, we don't want it to be like the elephant in the room that no one talks about. But it's interesting because as physicians, we're taught pathology and then we're taught like the full picture. It's like, this is diabetes. We're going to talk about diabetes today. And like, how does a person get diabetes? It's like, you're going to go into a clinic. You need to know all the things about the clinic to be a business owner who is not with their head in the sand when it comes to like, why do 50% of businesses close within the first few years? Like, why is that, of any type of small business? And whatever we can do to learn from it, and whatever we can do to help others understand, like, had you thought about this? If your business is failing or your model is wavering, people are not joining the practice, whatever it is. But I think that there's nothing to be embarrassed about or shameful about, because the fact that even the people who are thinking about, could I do DPC? That is hugely different from what I ever was exposed to in residency, as I'm sure you were. Private practice was like, oh, no, we don't do private practice anymore. You just work for somebody. Yeah. So when you said that you were just like amazed that people were calling, what caused that amazement? Like, what were they saying when you were doing those Saturday clinics that kept you to go full steam ahead in the summer?
Well, I was scared too, because, I didn't have a patient base. So most of my patients, I worked 30 minutes away, and all of my patients were VA patients. So VA patients are not going to pay cash when they can get free care, right? Because most of the VA patients don't pay. So I knew I wasn't going to have a huge amount of my veterans who came over. And now I do have a few that have come and followed me. But I guess for me, what they kept saying was, wow, you really listen. It seems like you really care. We wanted to, my practice manager, Eric, he's a good friend of mine. I've been friends with him for 20 years. He's like my brother. He helped me start the practice. We really wanted to have a place where when people came in, they felt like family. And I know there's so much stigma about keeping a line. You want to have a line drawn with patients. You don't want them to be too close to you. They're not supposed to be our friends or go to lunch or all these things. But we did want to have a very, very loving environment and a very encouraging environment. So we tried to make, even though we don't have a building with a front porch, which eventually I do really want, we actually put a rocking chair in our patient lounge. We put books out there. We had a library. We had honey from my farm. We have just kind of things that we wanted to make people comfortable. We wanted to make people feel like they were the only person there. And so we tried to stagger the visits, making sure nobody was visiting, like nobody was waiting for their appointment. We actually named our loud chair the prayer chair. And so we're both Christians, and we wanted to be able to encourage our patients that are Christians. So we pray for our patients who are Christians. And that has been a huge thing. I think people are shocked when we start praying for them, because I think that I can only do so much, when it comes to certain things. And so spiritual care and that kind of thing was important to people. So I think even though I am very much a normal doctor, I've attracted several patients who are not into modern medicine at all. I have patients who do not care about taking any of the medicines that I recommend at all, but they still pay me a fee every month, which I don't really understand. But are here because they know I'm going to care about them. And I think they know deep down that if something really bad does happen, then I'm going to take charge and make sure they get the help that they need at the end of the day, that they can rely on me. And I think that's really what people want when they think about a family doctor, is somebody that, I may not have anything wrong with me right now, but when I do, Dr. Phillips is going to figure it out and she's going to be there for me. And I think when we have that environment in our clinic, that really helped people realize, hey, this is something I want to keep doing. And so for me, that was really important, is just having that family. Because I get so excited when I think about someone that's my patient. I've always wanted to do primary care, even from the very beginning, because I love the idea of just having my patient. This is my, I got a new 5-month-old yesterday in clinic, and I was just like, this is going to be my little patient. And I'm actually going to have her till she's 20 or whatever, I just get so excited about that. And I lost that before. I lost that. I'm about to cry, but I lost it, for a long time. What I signed up for is that not the mess that I've been in for 10 years. And it's so good. And I love it. And I'm just thankful, because I think I would have left medicine if it hadn't been for this, because it's how it's supposed to be. I did rotations even, in residency. I remember one of my favorite attendings in med school, my 4th year rotation I did with her. She was a family doctor. At the time, she was working in Blacksburg, Virginia. And I remember sitting in her office, watching her look out the window and just bawling her eyes out, because she kept having to see 30 people a day. And she was so afraid she was going to miss something. She's like, I know we're missing stuff. I know we're missing stuff. And she was just crying her eyes out. And I was like, how are we supposed to do this? And it just made me almost not want to do family medicine. But I'm like, I'm already on. This is what I want to do. There's got to be some light at the end of the tunnel. Maybe I won't have to see 30. Maybe I could see 20, or, somehow I can make it work, and I didn't know about DPC then. That was in 2010, before it wasn't as even a thing, really. So, yeah, it's been a journey for sure.
I'm sure there's other people who are getting their Kleenex boxes out right now, because it is something that I feel that most people have gone through. I mean, maybe not audible so that other people can hear, but it's it absolutely happens. I have talked with so many people who the tears have come, the stress levels have been unbelievable, the questioning of what am I doing here? Why did I go into medicine? All of these things are so real. And it is so wonderful that this 5-month-old has you for her life now. It's amazing. And she would not have had that had you chosen a different path. And so the fact that you are here and the fact that you are grateful, I think it also helps us really put our heart and souls into our practices. And that's why if you've seen one DPC, you've seen one DPC. And this also goes into my next question with regards to the growth that you experienced between January and July, because when patients are sensing Dr. Phillips is my doctor, she's my doctor, how did your practice grow? Was it because they were, hey, you're my neighbor, and I'm so sorry that you're going to that clinic, but you want to hear about my doctor? How did your practice grow to go along with this gratitude that you had that patients were sensing as you kept practicing in your DPC?
Yeah, well, word of mouth is the best advertisement in the world. I mean, we know that. And I think that it rubbed off. People saw how much I cared. They saw how much Eric cared too. I mean, it was really a team, both of us together. And they spread that around. They tell other people. They talk to their friends about it. I have one patient who drives 45 minutes to see me, and he just saw an ad on Facebook. We run a lot of Facebook ads, and they're cheap and they work great. That's where a lot of our patients come from. And, we touch the heart of why people want to leave their doctor. Do you have time for me? Do you care about me? Do you? Health is a very intimate thing. People want intimacy with their doctor, and they really do. And not just women either. I have a lot of male patients, and I think problems. I worked for the VA for 10 years, so I know all about prostates and all about everything. I'm like a male specialist, really. I mean, I really know a lot about men's health. So I've been really attracting a lot of males too, because I think that they understand that I am going to take care of them. But also, I've been trying to put out a lot of stuff for farmers, because farmers don't want to come to the doctor. They don't want to ever come to the doctor. Number one, they're busy. They have a lot of work to do. Yeah. And they never want to do anything for themselves. And so when something gets wrong with them, they do not want to come into the doctor. So that's one thing I've been trying to push to a lot of farmers, is that if you get sick and you have a sinus infection, I will not make you come in. I will call you in some antibiotics. Like, I really don't need to see you anyway. So you just call me up, let me know what's going on, and we'll get you treated, and you don't have to come in. Trying to do that and then be like, get your butt in here. There's something wrong. You know what I mean? And they know I'm going to fuss at them. They want that kind of relationship. Like, okay, she's got my back, but she knows I'm not going to do that, but she's going to take care of me anyway. You know what I mean? So it's really an interesting dynamic in the South of the farm, taking care of the rural community, because there's a lot of patients I know they're not taking their medicine, but they know I'm not going to judge them. And it's funny, you use the term all the time, shared decision making. There's some patients that they don't want to hear a shared decision. They're like, tell me what to do, I'll do it. I don't want to hear what you think I think about it. Like, I don't care. Why do you care what I think? Just, I'm going to do what you say. I'm like, okay, well, that's great too. Just do this then. So it's interesting, the type of patients that we have, but there's a lot of patients too that want to do a lot of research. They want to make sure they have everything in line before they take anything I give them too. So it's a good mix, but it's really interesting, the patient types that I have. So it's fun. Yeah. Just being real with people.
Yeah.
Yeah.
I love that. And I'm laughing because, not the South, but the Midwest, where I practiced in Superior, Nebraska, when I was in medical school and residency. I'm just laughing because I know all the farmers in the, the alfalfa farmers and all the people who were doing farming in Nebraska, who, same thing. You're like, I saw you at the grocery store. I saw you buy those Twinkies. Like, I'm not going to judge you, but I did see you. I need to acknowledge that I saw you do that. And it's like, yeah, like, I would hear the stories of like, who was the person that was, other than themselves, who made them come in to like get their actinic keratoses frozen off and stuff like that. So I'm laughing because that is so farming community, no matter what farming community you're in, which I love. And I feel also that in places that are rural, the connection to a true family medicine physician is so strong. Like, it has not necessarily watered down over time. I get it that there are areas where they do appreciate in rural communities family medicine, but they don't have access to it. But there's still this remembrance, this cultural remembrance of like, I just need my doc, right? So it's very cool that your community has that. Now, let's go back to your patient population, because you mentioned how there's around 2,700 people in Royston, and there's not a lot of access to urgent care, because you created something which is phenomenal. You went out and reached out to the college, Emmanuel College, which is now Emmanuel University, to provide urgent care services, not only to your patients, but to college students. So tell us about Emmanuel University and how that all came to be.
Yeah. So what we're doing at Front Porch is really unique and really cool. There is actually an urgent care in town. Funny to say, there is an urgent care in town, but the college was not really happy with that. They didn't have a health center. So a lot of rural colleges, a lot of small colleges cannot afford a student health center. And so the majority of health and wellness fees that are charged to colleges, that colleges charge to students, really just includes maybe a campus nurse or possibly a little bit of counseling services, but really it's very tight budgets. These schools are on a very tight budget. And being able to afford like an actual mid-level provider or an actual doctor to be available to the students is very rare. And so the students are kind of left on their own most of the time, especially the trainers. At Emmanuel University has a lot of sports. So they have 750 students, but over 500 are athletes, right? So their training room is overwhelmed with medical problems. So their head trainer was just like totally overwhelmed, and she's amazing. and really awesome to work with. And I work with her daily to take care of these kids, but they were all coming to her because there's no doctor, right? I mean, that you could go to the training room when something's wrong. And so these trainers were just really overwhelmed, could not handle. They had no team doctor, no backup when they needed x-ray orders, whatever. So I approached the college with a proposal to provide care for the students. And so I was in a really unique position to offer that because I was just opening. I actually reached out to the college myself. I reached out to the CFO. It is a small town and I live in this town. And so I also graduated from Emmanuel University. So I use that as kind of like, hey, I'm an alumni. I want to meet with you. I want to tell you what I have to offer. They know how much I love Emmanuel. I still talk to some of my professors that work there. And I love the students. My daughter's a student there as well, which also helped. So I approached them. I told them what I wanted. I asked them straight up for $325 a semester per each student to offer full DPC for each student, right? So they had a current student health fee of $47 a month that they were charging. No, 50, I think it was 57, but they were charging just that amount each semester to each student. And so they told me, oh, we don't want to increase tuition. Apparently, there's a lot of pressure on these colleges to not have a higher tuition. They want to have a lower tuition. It attracts more students. Lower the tuition, the better, obviously, right? So when you're going to make a choice for college, you're going to choose the cheaper one. So they did not want to increase the amount. So we went back and forth a couple times and settled on urgent care only services. So I provide 2 free urgent care visits for each student at Emmanuel per semester, plus a sports physical. So there's a potential that I would have 3 encounters with the student, and that would all be included under their student health services fee. So the way that I structured it, Emmanuel pays me $47 per student per semester to take care of these students. So I did not know what was going to happen. I didn't know if I'd get 1 person a day. I didn't know if I'd get a few students a day. But for me, I only had 80 patients. And so that extra income for me was like, okay, I'm going to do this because I have time to see how it's going to work out and I'm not full. And this is the perfect time to do it. So what it has turned out, and I was going to update everybody on the Facebook group too, but I'm going to tell you what has happened because I ran some numbers before this meeting. And so what's happened is with this 750 students, I've averaged 3 to 5 patients a day, 3 to 5 visits a day. I'm only open 4 days a week. So it actually coming out is a great value for me because if I charged $125 per visit, that's about what I'm getting paid when you average it out. So it's actually coming out to be a great value. And the other great thing that I've done that I think that is kind of smart business-wise is I'm actually not giving the students a discount. I'm not giving the students discounted prices. So if they need a thyroid check, I'm not giving it to them for $3. I'm charging them $20. If they need an antibiotic, they don't get it for $2. They get it for $15. It's like a convenience fee. So they are purchasing some of the stuff on site, which we're making a little bit of profit off of. A lot of times they're opting to get it at the pharmacy, which is totally fine with me too. And I don't pressure them to buy anything in the clinic. And the majority of the students, actually, we don't make any money off of other than their fee that we're getting from the college. So the college actually pays us. They collect that fee from the student and then give us the check every semester. So it's been really great so far. I don't know if I'll be able to see 3 to 5 acute visits plus have 500 DPC patients. So my thought is that I maybe won't take the full 500 patients. I may only take 300. I may only take 350, so I'll have room to see the Emmanuel patients. But we don't take any walk-ins. I make them schedule an appointment. That's worked out great. I don't want a lot of college students in the patient lounge when I'm trying to see patients who are well visits for kids, making everybody sick. You know what I mean? So we try to stagger them and schedule them all together in the end of the day. But it's been really great. It's been successful so far, and I think it's going to be sustainable. So I'll have some real numbers I'm going to share with everybody on our groups. And so everybody can see, hey, this is how this is working, because I haven't heard of anybody else doing this. So it's a new thing. It's a new way to try to get patients. A lot of people are talking about employers and getting employer contracts, but working with colleges, I think, is a great way to grow a DPC. Plus, I've also gotten one patient whose mom came by who I saw the son and she signed up. So I got a parent there. So that was super awesome. So it's just getting more word out about my practice too.
I'm just sitting here like, look at you go. I'm just so excited because it's like,
so good.
I just wonder, like, as you were, back in this life of like, God, what am I doing? I know I'm burned out, but I have to do it because we have a $500,000, farm and like all these things I just have to do it. And then now you're like, I could go propose to a college. Like your story is so like, it's so demonstrative of the freedom that you experience when you're just allowed to be a doctor. And that doctor includes celebrating who you are as a person. So I'm over here like cheering on mute because I'm like, oh, I'm going to be too loud. I'm like, yes. So good. So yes, please, like, we are so excited to continue to hear the updates. And I want to ask you there, when you mention how, like, you might not have 500 patients, cool, separate from the college kids, but like, how are you gauging that? Are you gauging that on time with your daughter? Are you gauging that on like how you're feeling internally? How are you gauging like, I'm okay not putting people on a wait list yet for your own practice separate from Emmanuel?
Yeah, I want to be able to look at my schedule and I don't want to see more than 6 or 7 people a day. So that's how I'm gauging it. If I start seeing more than 6 or 7 a day, I'm going to put a stop on it. But I'm not including like Emmanuel students in that though. So right now, like today I think I saw 4 people. And then I had 2 EC students. So in my mind, EC students are totally different than my DPC patients because I'm not prescribing any chronic meds for any of these students. Like if they need a chronic medication, I'm doing all urgent care. And see, I did urgent care on the side for years. So I'm not responsible when they leave. I'm not responsible for follow-up. I'm not doing referrals for them. I'm not doing anything like that. Like I did refer a girl for an eye issue to a specialist, but like I'm not doing like a chronic problem, so it's a totally different mindset with the Emmanuel College students. Now, if I do have a couple that signed up for memberships and those kids, obviously take more time, mostly for ADHD. I have a couple that I have on ADHD medicine, but it's just, for me, that's a good gauge. And I may end up working I may end up opening 5 days a week. I think I may have to do that. Right now, I like having that day off during the week, but I may open up because that's not a deal breaker for me. I'd rather leave at 3:00 every day and work 5 days a week. And I may need to do that. I may need to add a day. I haven't decided yet. But right now I'm cruising pretty well at 150 patients plus the college. But my goal, I think I'm going to probably have to cut it off at 300, I'm thinking, or hire somebody like a mid-level to do the Emmanuel College thing, which then would kind of negate it, I think. So by the time I hired somebody, I could just do it, and have less DPC patients. So I don't know, but I think I will be full. The way we're growing right now, we're having 5 or 6 new patients a week. So I don't think we'll be long before we're full.
So proving every day that patients need care.
Yeah.
Patients need care from physicians, which is awesome. No, with the Emmanuel students, I'm also thinking that like a lot of those 3 to 5 visits that you have for the college students, that you're also doing telemedicine with them, which makes their lives a heck of a lot easier because they're just like, hey, got a thing. Here's a way to handle it over telemedicine. They don't have to, come on into the clinic and take care of it in person because you need their magic code.
Yeah, eventually that will get better. So right now, my malpractice insurance, it doesn't let me do telehealth only. So I'm making them all come in, unfortunately. It was way more expensive to not see them in person ever. So I have not gotten a telehealth only agreement. And I did have to have extra added onto my malpractice to have urgent care services for the students. So I have that specifically in my malpractice to cover Emmanuel University. And I do think it made it a little bit more expensive because some of my quotes that I heard other people, I'm probably paying a couple $1,000s more a year for this coverage, but I'm making them come in. But I do say, hey, if you have another problem, you don't have to come in now because I've seen you once. So we have a relationship. So I can do a telehealth after that. So I think as I grow and more kids learn, because we send out emails, I did flyers, we went on campus and when the parents came, I wrote this parent letter that you can get on my website. It's actually under the college section on my website that I wrote to the parents, basically saying, hey, I'm here for your child. sign them up for a membership. I'm trying to get more students to sign up for an actual membership in addition to their student health fee. But that has not been successful, very successful right now. But I'm hoping as time goes on, I have more people sign up every year.
Well, let me ask you this, because like you went to Emmanuel and now you're local. How many of the kids who go to Emmanuel stay local to the, Northeast region of Georgia?
I don't think a lot. I think most of them don't live around here afterwards. But there are 200 commuters. So those kids are definitely, hey, this is something that, and I've already had kids come in who are on chronic meds who I get their med list. I'm like, oh, okay, well, if you ever need a doctor, I can take you on as a member. This is what it costs and that kind of thing. So, I mean, who knows what kind of seeds I'm planting for them to be able to look at this type of doctor, even when they move away. They'll see how good it was and they'll look for a DPC doctor. You know what I mean? We're planting seeds everywhere.
And as you're, watching your trajectory grow, your practice grow, how are you keeping track of the data? Like you're talking about how you're watching the numbers with adding the college or the university students on. But in terms of like, if you were to isolate data for a particular subset of patients, like these, the kids who were just using me for the urgent care services, but have now become members, like how are you able to parse that data out compared to the rest of the growth of your clinic?
So we have set up all of our Emmanuel students to look just like an employer in the system. So whenever they sign in, they're in there as an employer or under Emmanuel University as the employer. So we can pull out all their data and share all of the utilization. So they can see how many text messages I've sent, how many prescriptions they've gotten. And so we can run that. And then I'll easily be able to see who moved over to a separate membership. So if they actually purchase a separate membership, they're not under Emmanuel anymore. They're in my DPC. So I would be able to see who moved out pretty easily. The way that is set up is really nice. And it's really easy to run the numbers and see who's who with what. And I'm meeting with Emmanuel next month to do that exact thing. So I'm going to be able to show Emmanuel, hey, look at this value that you're getting from these kids and look at what they're saying. And, also how I'm working with the trainers. So I send all the notes to the trainers. I've had all the students sign waivers allowing me to give notes to the trainers because the NCAA requires that anytime a student athlete is seen by a doctor, that the Emmanuel College has to keep track of that. So they have their own rules and things that they need to do to keep track of everything. And so it's really important to have a good EMR that's set up to do that and be able to show that value to the college so they can see how much the students are using you. Is this something we want to keep doing? And also making sure geographically that your clinic is close to the college. I really want to be on campus with my clinic. Like I want to be right there to where kids can walk to my clinic, but I've not been able to get a location that's on campus. Right now we're 2 miles away. So sometimes students bike over. I do have kids that bike over, but most of them have cars because we're in a rural area, or they'll get a ride. And I've also let kids do so I'll see them on telehealth. If they can't get a ride, I'll do a televisit, but then I make them come in the next week and see them in person. It's annoying, but it's just how I have to do it right now. But I have done that too.
It's awesome though that you mentioned how the telemedicine coverage is in your area, because it's definitely not like that everywhere. And so very important, especially if you're looking to practice in Georgia. What Dr. Phillips said is super, super important to keep in mind. So when you talk about space, you have a physical location. Did you open your Saturday clinics at that physical location, or had you been practicing at a different location before moving into your current space?
So I opened in a building that people who own the building actually are affiliated with the college. And so they really wanted to build this relationship with me. And so they gave me this space for half the amount I'm paying now. So they basically said, okay, since you're only going to be open on Saturday, we'll let you go ahead and start working out of here. Since you're only open once a week, you only have to pay us half rent until July. And so that was super nice because I was paying very little to be open here. And they had it empty. So really there's so much rental space around here. They were just trying to find somebody to go into it. And the really cool thing was there was a urologist here a couple of years ago. And so the exam tables were here. The lab was here, like all the lab chair, everything. I didn't have to buy any of that stuff. I had a very unique situation where I just walked into a clinic that was full of stuff We actually had to throw away a lot of stuff because it was just old and expired. But I mean, everything is here. And so I had actually found this like really awesome exam table on sale and drove down to Atlanta to pick it up. And it's still in my storage right now. I'm not even using it because I found this place, so I've got that for whenever I do. Hopefully I do eventually want to have a building with a front porch on it because that's Front Porch Family Medicine. Hello. We need a front porch on a rocker in front of it. But there's a dentist actually that his dental office is on campus, like right in front of the campus. So I'm just waiting for him to move out of that building. I'm hoping to take that building once he moves out. He doesn't own it, but once he's planning to build a clinic of his own because it's too small for him, but it's perfect for what I need. Because, dentists have a lot of dental hygienists and they need a lot more rooms than we do. So he's hoping to build a new building. So I'm hoping to get that eventually, but if not, we may build a building or something like that. I'd love to have my own building because I don't want to throw money away on rent, but at the same time, we are not paying that much at all to be here. And it's the perfect size. I have 2 exam rooms and a waiting area, and that's all I need. And the lab. It's perfect.
Love it. And I want to ask here about how you mentioned Eric was very helpful. He's like a brother to you, and he was helpful in opening the practice. When you talk about Eric, at what point did he, start coming in the conversation, and what types of conversations did you guys have? Because, opening a business is usually something that we're not like sitting here making a decision. We don't talk to other people about it. So like, what were the conversations that you guys had that helped, center your goals or help bring him into the fold so everyone was working around the same goals for Front Porch?
Right. So Eric was a really big reason that I took the plunge too. And so that's why I'm glad you brought him up, because for me, I was very intimidated by the financial part of it, and I'm not business minded at all. And I don't even like math. I just hate numbers. I still can't really even talk to people about money. I hate it. I don't like the Emmanuel students when they come in, like I don't ever offer them. Eric does it. He's the one that does it because I'm just like, so I don't know why I'm like that. I just hate talking about money with patients. I just don't know why. I shouldn't be hesitant, but like Eric even says, he's like, you'd let everybody come for free if you could. I was like, I know, I just want to take care of everyone for free, but I also need my paycheck, please. You know what I mean? So it's hard. And he really helps me with that. And, he actually moved back from Georgia from Virginia. He was working for a big corporation doing their tax stuff. And he has a business background, and we are very close friends. And he moved back to Georgia, and he needed a job. He had a few things open, and I was like, you know what? I'm thinking about doing this. What do you think? And he's like, it looks like a perfect business model that cannot fail. Like, we need to do this. You need to do this. You'd be way happier. He knew how miserable I was in the VA. He's like, we got to do this. And so he actually helped me do all the research. We signed up for DPC, the TPC Frontier, and got all the stuff off DPC University. I sent everything to him. I also had Eric to help me do all the payroll and everything like that. So I didn't have to figure that all out. He knew how to do it already. So that was really unique. And I really encourage people who, if you have somebody like that in your life that can do that part of it, it really helps it be less stressful. And also, I don't think I could have done just the Saturday clinics and also answer the phone all week and work my job at the VA. He answered the phones for me because we needed to have somebody answering phones and returning messages during the day. So he actually worked his other job and took care of the phones and everything for when we were growing and getting people scheduled for the Saturdays. So I call him my practice manager, but he does everything. He manages all of our patients. He does all of my front desk work, all of the administrative stuff. He also does a lot of the pharmacy stuff. I order the meds, that he helps me with inventory and everything. So even though he's not medical, he does a lot of medical things I've trained him to do, which is totally legal to do. He also can do EKGs. I trained him to do that. He doesn't draw blood or anything. I do that, but he helps me process the labs. He gets them all ready and gets them he does everything for me. So he is really my right-hand person. I'm paying him a full salary right now, which to me was really important to keep him. And so it's really cut down on my income, but it's at the same time, it's really important for him to be here, I think, because he's just really important to and I wanted to have someone that, and for some reason in the South too, patients don't want to call me for certain things. They don't feel comfortable calling me. They'll be like, oh, I didn't want to call you. I'm like, you're paying me, call me. It's fine. and they feel way more comfortable calling Eric. So that's another advantage of having somebody help you. But you don't have to have someone help you, but it has been way less stressful for me, I think, having Eric there to take care of all the stuff I don't understand, and making sure that I'm in line with everything. He helped me put all together our folders and all our stuff for the pharmacy. We had to have a bunch of rules we followed. And so we have a big binder we keep. And it's so nice not having to worry about that stuff. He does all that for me, and making sure all our forms get sent and everything's signed and the ID is had and everybody's paying their bill. And I don't have to deal with people when they don't pay their bill. He just bothers them and stuff, but I don't really have that happen a lot. Most people, we were actually talking about that yesterday. We're like, most people pay their bills. We don't really have trouble with that. So
that's really good. That's really, and I think that, and do you think that it has anything to do with being rural? Because, it's like, there's a little bit more of that, like everybody knows everything in the community type of feel.
Yeah, for sure. Like half the patients that we see at the store or whatever. Like, I mean, everybody lives with everybody. And so everybody knows everybody, and everybody's in that pickleball club, or went down to Bebop's Bakery, and, or goes to Royston Method. It's just that kind of feel. And so I love when people when they write reviews. So one of our big things to get more patients was to get people to write reviews. So every single time a patient came in, we gave them a sheet with our Google information. And we also had a thing that they could like screenshot when they left to get to our Google page to leave a review. And then Eric also send them a text and say, if you liked your visit today, please leave a review. And so we have over 25 5-star reviews on Google, which has been awesome. And I love when people write in the reviews. Eric and Stephanie made me feel like I was at home. Like, I love when it's Eric and Stephanie, because that's who we are. Front Porch Family Medicine is not just me. It's Eric and Stephanie. It's both of us, because we're both in it for just to love on people, to minister to people. That's our heart. And Eric's got a business heart, but he also was a missionary in Peru for 5 years. So he's a servant at heart, and so we're both here to serve. And we both have a passion for serving our community, right? So that's what we want to do, is serve others. And we're not here to be rich. We're never going to be rich doing this, but we want to love other people. And so I love that I have that person that they know they're going to see at the front. And people do know I am very busy. I have a lot of stuff going on, patients who need me, blah, blah, blah. And, I do love having that support. And I think patients appreciate having somebody they can be like, oh, Eric did this for me. I didn't have to bother Dr. Phillips. They like that, I think.
And I think how you're talking about the both of you love to love on your patients. I think it also helps that accessibility when, you don't have to be I totally feel you, because we have our amazing nurse, Domelane, who is our Eric. And it's amazing when I don't have to put one more thing on my plate, because I do have Dom helping. And so I think that it's definitely something to think about if you're looking to do DPC. What would it look like if I opened by myself? What would it look like if I opened with a person? At what point would I envision, or could I envision having another person join me? Who would that person be? All of those questions, they're all valid, but I love that you found a way that works for you in your community, especially given that in your blog on your website, you had mentioned your statement when you applied to residency. And this goes in so beautifully to what I want to ask you next, because in that statement, when you applied to residency, you had talked so deeply about taking care of forgotten patients. And I want to go back to, in closing, this place that you were in where you had seen your attending look out the window and cry and wonder about what has she missed. You were feeling it yourself. That there's other doctors in the hospital and clinics around you who are feeling crazy burnt out. What can you say to not only forgotten patients, but how is DPC addressing forgotten physicians?
I just want to hug them. I want to look at Dr. Bradford was her name. I haven't even talked to her. And I just want to just love on them and say, if there's a better way, just come. It's come over to this side. It's better. It's so much better. It's so good. And we are forgotten. I think we're just burning everybody to the ground with this way things are. It's just broken, and it's so much about money and profit and codes and BS. What are we doing? Like, I just want to slap in the face the doctors back in the 60s who decided to be family doctors and take insurance. We should have never done that. We should have never taken insurance from the beginning. You don't have insurance to get your oil change on your car. You should not be paying insurance to see a basic specialist or a basic family doctor. You should not be paying insurance for that. Insurance is for hospital. It's for major surgeries. It's for major procedures you cannot afford. It's just, we've got to change how things are done in this country. And it's broken. Our system is broken. We have patients who are lost, but we have so many more doctors who are lost. And we can't lose them because we're losing them in they've lost that passion. Just like I said, I was just another cog in the wheel. Like I wasn't even me. And even my mom and my husband and my sister, she's like, who are you? I don't even know my sister. This isn't you. The way I would talk about patients, and I would just be burnt out and be like, oh, this person, I can't believe this person's coming back in. Like, it wasn't me. That's not me. I love people. And, there's a certain element to growing up, and, you don't love everyone. I mean, come on, this is the world we live in. But still, I just lost my passion. I lost what I went into medicine for, And I remember when I took tests during medical school, how traumatic it was. I don't even remember it because it was like PTSD from how, much we studied and stuff. But every time I walked through the door of a test, I would be like, this isn't for me. This is for my patients. This is for other people. This is why I'm here. And I always said, why am I walking through the door every day? Why am I doing what I'm doing? I think everyone in their life needs to ask that question. Why? What am I doing? Why? Because if the answer isn't something really good for humanity, don't do it. If it isn't good for you, don't do it. Like, we've got to do things that are healthy and that are good for us and other people or other people. We're killing ourselves. In the rat race, we're trying to make more money. There's a study that came out that said that, people do not get more happy by having more money. It's not making you happier. You're only going to spend more money. I think the cutoff was like $90,000 for Americans. I don't know if you've seen this study, but it was fascinating. And it was basically like, they did a survey, thousands of people, and people who made $60,000 a year versus $90,000 a year, the $90,000 a year people were more happy. Okay, so that's like, yeah, that makes you more happy with more money. But the people who made $90,000 a year versus $300,000 a year, they were not any more happy. They actually were less happy, the $300,000 people, because it's just not going to make you happy. It's not being super rich. And so I think if we change our mindsets, but at the same time too, you can also make $300,000 a year doing this. So really that argument doesn't matter with this. So you can make the money, but at the same time, my focus has just changed. It has. And it's not my goal as much anymore.
Well, you are doing amazing things, and we cannot wait to hear updates as you continue along this amazing journey. So thank you so much, Dr. Phillips, for joining us today.
Absolutely. It's been fun. Sorry I cried and everything. I mean, I'm just like, this is me. This is who I am. So I always try to put all that out. Take it or leave it. We're not normal doctors. I have a taxidermed bear in my patient lounge and a squirrel in my office that I used to have from JCO when they came and did their inspections. So I'm not a normal doctor, but I like to have fun. And I really enjoyed this interview. You have a passion for patients too. And I love encourager you are. Like, this interview has helped me a lot and been such an encouragement for me. So thank you for all your kind words and everything. So it's been great.
Next week, look forward to hearing from Jay Keese, Executive Director of the DPC Coalition, who will bring us an update on DPC from Capitol Hill. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.